When you're just looking at a picture on an X-ray or an MRI, maybe they have some bulging discs, okay,
Hmm.
on an MRI. That's very common. I forget what the percentage is, but it's very high of people having, positive findings on an MRI in their
Hmm.
low back and yet being asymptomatic. So the question then
Interesting.
is, okay, so do these bulging discs, are they actually causing your pain?
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome back to the Optimal Health Guide. I'm your host, Michael, and I'm here with Josh Vance, the Optimal Health Guide. Josh, how are things going for you today?
Oh, it's been pretty busy today.
Yep, I would imagine. Yeah, pretty busy time at the clinic. Well, today we're going to talk about something that sits, kind of underneath a lot of the frustration that people feel. What happens when you don't actually have a clear answer? We've talked a lot about the clarity that you help to be able to drive people toward, because a lot of people have, tried multiple treatments maybe before they've come to you, or they've seen different providers with different philosophies and approaches. They've heard a lot of different explanations. I mean, heck, they're marketed on their devices with all kinds of different problems to be able to solve and address, and how this is the right and quick solution. So they're usually left wondering what's actually going on. So today we're going to go a little bit deeper into some of the things that we've talked about before, not just into what diagnostics are, because we've laid that foundation already, but into why people go so long without getting that real clarity and what changes when they finally get to it. So I'm excited to see where we go. Before we get into that new content, I do want to remind everybody listening that we are looking for listener questions or topics. So as you're listening, if something connects with you, or if you've had an experience where you felt like you didn't get a clear answer, we'd love to hear from you and talk about the situation that you are, interested in. You can go to podcast.vancept.com. You can submit your questions or your topic there. And we're right at the cusp of shaping season number 3. So we're really hungry for your input and feedback. So, all right, here we go. Question number 1 for today's talk. Josh, what does it actually feel like for you as a provider when someone comes in without a clear diagnosis?
Well, first of all, I would say now versus when I first started, like 26, 27 years ago, whatever it's been, yeah, I feel very differently. Now, much of the time, diagnoses are pretty general, like, it might be, left knee pain or right shoulder pain, low back pain, neck pain. When I first started, um, it really bothered me. Because I
Hmm.
thought, these physicians, these providers that have so much training, and they're only giving me this much information. It would be
Yeah,
really good to have a whole lot more to go with to really help this person. But that's kind of how it was, and how it often is. At this point, I don't really get my feathers ruffled much anymore
okay.
like I used to. I think when I started, when I saw this happening, I started kind of beginning to look at it as more of an opportunity
I
to
like
to
that.
become a better clinician, to really
Yeah.
kind of refine my skills, to be confident in what I'm finding, so that I felt like by the time I was done with the evaluation, okay, I know exactly what's going on. I know we need to do this, this, and this, and we'll be able to, you know, help them out and get them back to where they want to be. So it doesn't really bother me anymore. Now,
That's great.
patients sometimes are frustrated because they may
I can
want something
imagine.
specific.
Yeah.
They're looking for, I have this, they want to put a label on it,
Yeah.
which I don't think is necessarily a bad thing, but I think sometimes patients need to understand it's okay not to have a label.
Yeah.
But, from my point of view, there are many patterns to different areas of the body and problems that can cause dysfunction. Okay.
Okay.
So after you've been treating for a while, you begin to see these pain patterns and movement disorders and
Yeah.
recognize this is going on. And I'm probably going to see problems in this muscle, this muscle. I'm going to see tightness here. I'm going to see weakness here. You begin to kind of see a pattern to different kinds of
Yeah.
diagnoses.
Why
Yeah.
don't you name one or two of those patterns that you might typically see?
Okay. So one of these patterns tends to be someone maybe with a rotator cuff issue. May not be a severe tear or anything, but they may have some tendinosis, some degeneration of the tendon, or possibly even pretty good case of tendonitis. Generally, you're going to come in with, limited range of motion, sideways, sometimes forwards, pain when they're reaching overhead, pain when they're reaching out the side, pain when they're reaching behind themselves. Oftentimes, they'll also have a lot of discomfort in the upper trap area with tightness and sometimes limited ability to turn the head because of the muscle component or the myofascial component of, you have this, but these other issues kind of are secondary and they kind of come on and create some dysfunction. So you see the pattern, and then you begin to just handle the secondary issues as well as the primary issues.
Yeah. And then that pattern, do you oftentimes see it leads to a certain kind of diagnosis or label like you were talking about, or that just kind of clumps it together? Here's a pattern and it could go a bunch of different ways.
I'd say it is more of a clump. I mean, the diagnosis, in our scope of practice, physical therapists don't make a medical diagnosis. It's not in our scope of practice. We can make a diagnosis of function in the sense that they have impaired movement patterns, they have impaired range of motion, they have impaired strength, they have impaired gait,
Uh-huh.
but we don't make a diagnosis that they have
I see.
a rotator cuff tear. That's outside our scope. So there's a
Yeah.
fine line there.
Are there any other stories that repeat that you kind of see happen again and again?
Yeah, I would say people with low back issues, maybe they have a little bit of a bulging disc or a little sciatica, something, nothing major, but, they're getting some pain in the low back, the butt, maybe it's going down the leg. Oftentimes, not always, but oftentimes you'll see similar pattern where they're walking a little cattywampus. They're having some issues with that. They have very typical muscle tightness and very specific muscles in the low back and in the glutes. Usually some weakness, usually some range of motion. Usually in the hips are pretty good, but oftentimes they'll be a little bit limited in the low back as far as range of motion, particularly in if it's on the left side when they're side bending to the left. They usually don't do as well as maybe when they go the opposite direction because it hurts. So there's again very
Yeah.
typical patterns, and so you're very much treating a lot of, these muscle dysfunctions as well as, sometimes a nerve if it's a little irritated, and coaching
Yeah.
them through the process.
That's great. Anything else you want to address about that first question before I jump into the next one? I know in a way, cut you off with some of those specific examples.
No, I think the only other thing I would say is sometimes patients get a little frustrated, but again, if I try to focus on just letting them know, okay, these are the problems. The diagnosis is really not really the point. The point is, what do we have to do to get better? So we have this issue, we have this issue. This is what we need to do for this. We need to do this for that. And then I'm anticipating this is how long it's going to take. And when we're done, you should be doing good.
Okay. That's great. Well, what about where does the system tend to break down when it comes to diagnosing pain or getting greater clarity on what's going on?
Right. Well, again, limited time in discerning a problem from a medical perspective. I read, oh, I don't know how long ago, but it surprised me. It was a research article on how long it takes for, I think it was primary care, to come up with a diagnosis. And literally, it was within a minute. So they're getting the history. They're just kind of hearing the chief complaint. They've already got their diagnosis in their head, and they're maybe just doing a few things to confirm that. But it's really quick.
Yeah.
Right, so he surprised me.
Yeah, me too. I expected a much longer answer as you were unfolding that article.
Yes, I would have also, but that's what I read. So,
Hmm.
and I think probably a lot of doctors see some consistent patterns too in some different
Sure.
things.
That makes sense.
I think that it does happen. But I would also say that when it comes to treating patients, utilizing diagnostic tests, there's usually a pattern. Maybe there's been some trauma, they fell, they hurt their wrist. So usually x-ray is going to be first. And then assuming that's pretty normal, most of the time it is, then they're going to go to therapy. And then, if therapy quote unquote doesn't work, then maybe they'll do an MRI. But, you guys go through the whole insurance qualifications in order to get that.
Yes.
Kind of the downside is that usually takes, once you actually get in to see the doctor, and sometimes that's a while,
Yep.
maybe 4 weeks. Anymore, it seems to be quite a while.
Yeah.
And then they try something, maybe it's some over-the-counter medications, maybe they do an injection, something like that, and, tell you to go put some heat on it or whatever. Then, there's a period of time, which may be 4 weeks or whatever, before they get back to the doctor. And so, if nothing's really been improving in that 4 weeks, well, man, that's kind of a long time to go without having some help.
Yeah.
So kind of my thought is that, when it comes to neuromusculoskeletal disorders, physical therapy should be the first stop, because we are kind of like an all-purpose clinician trained in every major
Yeah.
body system. We're trained in the integumentary skin system. So in other words, that's the skin and all that. Okay. So we do wound care. All right. We're trained in obviously the cardiopulmonary systems with,
Hmm.
patients with heart issues, as well as lung problems, COPD, just breathing, with having had like coronary artery bypasses and heart problems,
Yeah.
as well as kind of the more obvious would be musculoskeletal, as well as the neurological. So people that have had brain injuries or peripheral nerve injuries, or any kind of those things. Obviously, there's times when other things have to be ruled out from the physician. That's absolutely true. But
Sure.
when we're talking about peripheral injuries and musculoskeletal injuries, sprain strains, things like that, physical therapy is it's very cost effective. It's been shown to be extremely cost effective, as opposed to having to go to your primary care and then getting a referral to specialists and all that process. That takes a lot of time, takes a lot of resources, and sometimes patient frustration, and they aren't really getting the things they want, when maybe if we started with physical therapy to start with, we could start teaching them the things that they need to do and start working with them to get better, without having to go on a bunch of medications that
Yeah.
maybe they help, maybe they don't help. Or I mean, there's a lot of people that have a lot of fear of being addicted to different medications too. There's been plenty
Yeah.
of things with the opioid crisis and all that. So they don't really want to have any medications, or they tried, over the counters that didn't really help or whatever. But they need guidance sooner rather than later.
Yeah. Now, what would be your general recommendation for somebody, let's say, that kind of fits some of the patterns maybe that you've already outlined, or something else that seems to be coming to mind for them listening in? Would you recommend them asking their primary care for a referral, or just coming into a physical therapy office and asking for support?
Either way would work, but, if they're pretty confident, example, maybe they've dealt with back pain before and they were bent over, they're tying their shoe and boom, their back went out again. Okay, great. Let's not necessarily take all the time. This is not a abnormal thing for you. There's nothing necessarily that needs a bunch of new testing or anything. Let's get in and let's get going and helping you. Maybe they fell and they've got some shoulder pain, but then, it feels like it's just sore. They don't really feel like it's severely injured to where they, need where it might be a fracture or something like that.
Yeah.
And they're just having some limitations. I mean, try physical therapy first. It's quicker than having to go to your doctor. You might have to wait 2, 3 weeks to get into your doctor.
Yeah.
Sometimes they're faster. It depends, but try physical therapy first.
That's great. What about this? What are the hidden costs of not having a clear answer? I know that you're normally pushing for clarity on what's going on. You're utilizing an array of tools to be able to discern that. But take us deeper. What's the hidden cost here, not having clarity?
I think, when we don't have clarity from a patient's perspective, sometimes there's confusion, which leads
Hmm.
to frustration, sometimes anxiety over not having a label,
Yeah.
as well as, when they're doing activities. If they have pain, our bodies are going to not like pain. So we're going to do what we can to avoid pain. So we're going to develop oftentimes compensatory strategies that may be
Yeah.
in how we're moving with our arms, reaching, lifting, carrying things. It may be in how we're walking. It may be just in like decreasing our activity level over time, which then kind of leads to some muscle weakness and different issues like that. But we can get that compensatory thing going on that then can also have an emotional impact, in the sense of,
Yeah. I could see that.
fear of, a lot of things. It could be everything from fear of falling with someone that maybe has some balance issues, to fear of repeated pain if they were going to pick something up, or or
Yeah.
have to bend down and tie their shoes, or fear that there's something really significant going on that's life threatening. The fear of not having an answer is probably one of the big things mentally that really can
Yeah.
affect a person. And then, of
Yeah.
course, there's dollars spent. If we don't have a clear idea
Mhm.
of what's going on, we're doing treatment and kind of running into the same speed bump and not getting past it. We're wasting time, we're wasting dollars, resources, be it insurance dollars or a person's individual dollars
Yeah.
from copays, your co-insurance or whatever. So, making sure that we have a good, clear answer is important so that we don't waste time, resources, and emotional stress over
Yeah.
things that really could be solved fairly quickly and easily.
That's great. Yeah, I'm remembering from a previous conversation where you talked about clarity really does help bring hope and even some sense of just, positive outlook that there is a way forward. But I can see the opposite side going here. Kind of hopelessness can be a really negative culprit in a scenario like that without having clarity. I can see the mental fatigue that would take place there.
Absolutely. And people sometimes get depressed,
Yeah.
right? That's
Yeah.
terrible.
And then compound after compound.
Absolutely.
Help us understand the difference between, quote, seeing something like in an MRI and actually understanding the problem.
All right. So when we're looking at trying to determine what's going on, there's a lot of different tools. And then coming up with a clear picture, it's not just one thing that a clinician would utilize to come up with what's going on. If we only rely on one thing, we're going to miss the mark. Sometimes we might get it right, but if we only rely on an X-ray, okay, X-ray look at function, but they may not necessarily tell us everything. So obviously there's, an exam. We need to listen to what the person's saying. Sometimes there's other tests that need to be done. The physician may suggest X-rays, MRIs, CTs, lab work, all that sort of stuff. And of course, then we can also do diagnostic musculoskeletal ultrasound to look at different things in EMG testing. But again, each has its own purpose. Usually there's several things together that need to be utilized in order to come up with a clear picture of what's going
Yeah.
on. So when you're just looking at a picture on an X-ray or an MRI, maybe they have some bulging discs. Okay, on an MRI, that's very common. I forget what the percentage is, but it's very high of people having, positive findings on an MRI in their low back and yet being asymptomatic. So the question then is,
Interesting.
okay, so do these bulging discs, are they actually causing your pain? Maybe,
Mhm.
well, maybe not too. So maybe, if you have fairly minor bulging discs, you may have had them for a while. Now we have this back pain after putting your shoes on. Well, maybe you just strained your back. I mean, there could be other
Mm.
things. Not saying that it's not, but there could be other things. But we don't always have a causality, I guess it might be the best word. But you got to be able to put everything into perspective. So some tests look at structure, some tests look at function, MRIs, CTs, X-rays, I would say those probably definitely look more at structure than function. EMGs are very helpful in that they look at function of the nerve. Nothing else actually does look at the function of the nerve. So that's certainly an important thing when we're dealing with some sort of a neural issue or a muscle disease where we have weakness, numbness, tingling, burning, any of those sorts of symptoms.
Yeah.
So again, the findings have to kind of coordinate with what you're looking at on be it X-rays, MRIs, CTs, EMGs, some ultrasound. If we're seeing some partial tear on the ultrasound on their shoulder and they present with limited range of motion and pain in a certain area, and there's tenderness to this specific tendon. Okay, now this is making sense. This is, the whole package is working
Yeah.
together. So again, it's just kind of all got to work together real nicely.
Yeah. I see that. Well, when you use tools like you were talking about here, like EMG or ultrasound, what are you able to see that changes the direction of care?
Okay. First of all, the research shows that 61% of the time, the physical therapy plan and direction have changed based on utilizing either an EMG or a musculoskeletal ultrasound to what the physical therapist's plan of care is. That's a lot of the
Yeah,
time.
that is a big
Okay.
difference.
So, when we're looking at ultrasound, we may, during our evaluation, think that, well, they have some shoulder pain. It looks like it might be possible tendonitis or maybe some tendinosis, maybe a very light partial tear at worst or something. So recently I did an ultrasound on someone, which I was kind of thinking in that lines. And
Yeah.
then once I got to looking at it, what they ended up having calcifications on one of the tendons. So I was like,
Oh.
well, I didn't really expect that. So we had to do a little education, change the game plan a little bit,
Hmm.
but it was very helpful to see that, okay, well, yeah, these things are perfectly good, but we have an issue with this. Other cases like maybe utilizing an EMG person with, well, actually, a person with numbness and tingling in both arms just came in
Hmm.
last week, and they had, I think it was 2 neck surgeries, multiple fusions at different levels,
Wow.
a host of other issues, but they were kind of having this numbness and tingling down the arms again. Obviously, they were very concerned
Hmm.
about what's going on. And so, we did the test and, all the nerves are good. They're totally fine. So, in that situation, they're not going to be going back to surgery or anything like
Yeah.
that. They can be doing something else to help with these symptoms. And they were actually sent back to their doctor because it was a physician that just all they wanted was a nerve test. They weren't looking for physical therapy. They were looking for
Yeah.
some answers.
Wow. I'm always amazed though, hearing the stories that you have to tell about the power of the EMG and ultrasound and how it just really does. It's like a superpower looking
Yeah,
underneath and at how things work. It is quite amazing.
it is
Have you
pretty
seen
cool.
Yeah. Have you seen situations where the diagnosis changed the entire trajectory of someone's recovery?
Yeah. Um, I think I might have mentioned this case, but they came in with shoulder pain, and we were really thinking they had some other issues, some numbness and tingling, and the pain in the shoulder, and they had weakness, which was a pretty big issue for them.
Hmm.
And they were pretty specific where the pain in the shoulder was. So we started treating. We did an ultrasound, and the ultrasound was totally fine, which I was
Hmm.
surprised about. I really thought, okay, well, this is a shoulder issue. Gosh, did an EMG, and they had a pinched C5 nerve pretty badly. And so, they were ended up because they didn't continue to, they weren't making progress after a while, sent to back to primary to go see a specialist to deal with the nerve.
Yeah.
So in that case, it wasn't
Wow.
the ideal outcome, in that physical therapy, was able to totally help them. But at least we
Yeah.
did figure out what's going on with them so
Yep.
that they can get the help that they need. Um,
That's really cool. Yeah. Again, and I appreciate it, even though you're saying, hey, I couldn't, take this further. At least I could give them the input that they needed to be able to get done what needed to be done there. That's great.
Absolutely, absolutely.
What signals should someone listen for to tell them, hey, I need to go deeper? I don't have the full picture going on in what I'm facing.
In the sense that maybe they have something else going on, or just clarify for me.
Yeah, I think, again, somebody's tried multiple things. They keep working whatever program they have, whether it's, without guidance or with guidance, but they're just not, it just doesn't feel like it's going anywhere. So I need to go deeper. I don't have the full picture yet of what's going on.
Okay. Okay. So, if a person's got some things and it keeps reoccurring, well, obviously something isn't right because they're having the problem again. So either they're doing something that maybe they shouldn't be doing, or, if they've had
Hmm.
therapy before, they've maybe forgot how maybe they're supposed to be moving correctly, depending on what kind of a problem we're talking about. Maybe it's their low back and,
Yeah.
they were doing well for a while, and then now the back's starting to bother them again. Well, okay, so maybe they need to relook at how are they moving. Maybe they've had therapy before, and I've heard this from some providers and things, and it failed. Physical therapy didn't help them. And so the
Hmm.
patient's like, well, I've had tried therapy before, it doesn't work. Okay.
Yeah.
Different therapists do different things, different doctors do different things. So maybe you just
Yeah.
didn't have the one that was a good fit for you or that was able to kind of discern what might really be going on. So maybe you just need to look at it from a different perspective.
Hmm.
So that might be something that could be helpful for them. When something, they've tried to do things on their own
Hmm.
and they've done the exercise and they've done Dr. Google and they've done the things online that tell them, and they're still not getting better. Okay, well, there's more maybe that needs to be looked at, and we need to keep a kind of different perspective on what's going on and do a full workup, if you will, and
Yeah.
looking at all the different variables that may be causing some symptoms.
Yeah. Is it normal? What's the order? Is it you typically might say, "Hey, I think you're a good candidate for a diagnostic treatment," or is it somebody comes to you asking for that? Which one of those tends to happen more regularly?
Most people don't really have a lot of understanding of what an EMG is.
Yeah.
And there are providers that really don't have a good sense of how beneficial an EMG is. They
Yeah.
know kind of the basics of it, but they don't really understand the whole picture.
Hmm.
So I would probably say more that I'm evaluating them, I'm listening to their complaints, I'm looking at things, and I'm thinking, okay, you would benefit from this or
Yeah.
both, depending on what the situation is. It's probably more for me than them. But there are some that are like, hey, I saw my primary care. They're sending me over to you. They said you might want to do an ultrasound with me or to look at my shoulder or
Yeah.
whatever it is. And or maybe they also wanted me to do a nerve test at the same time as physical therapy.
Yeah.
Probably a little bit more of the first situation though.
Say, let's tease this out too. Let's say that we continue to educate people and they really come to understand the value of this. Would it be appropriate for somebody to come in, they're doing a regular evaluation and say, "Hey, Josh, I really think that based on what I'm experiencing and what I've heard from you, I'd like to seek out some type of diagnostic treatment."
Yeah, so the diagnostic testing, I mean, if a patient has enough understanding and knowledge, and some are very well educated, I'm certainly willing to listen to them. I may ask them a few questions why,
Sure.
but generally in the evaluation and talking with an individual, I'm already kind of thinking, okay, well, what have they had done? Where are we at? Maybe they've had some testing or whatever. Maybe they haven't too. It just depends.
Yeah.
But I'm thinking, okay, well, do I want to do an ultrasound on their shoulder to have better understanding? Chances are the answer is yes on that. Are they appropriate for a nerve test? Well, depending on what their symptoms are, and if they are, then I may make that recommendation. Hey, I think you'd
Yeah.
benefit from this, and then kind of go from there.
That's great. Yeah. I love the care and finesse that you're providing there. Even if somebody comes fully well educated, thinking it's the right answer, I like the delicate way that you approach that. Yep, that could be helpful, but you're not looking to just have people experience, that kind of testing just because. So thanks for that. Thanks for helping us see too that the problem isn't always the treatment. It's actually treating the wrong thing. So again, thanks for being the guy to bring clarity here. To move forward with a clear answer and the best next step is clarity for you. You can learn more about how we approach diagnostic testing and understanding what's really going on at vancept.com. You can find the tab there for diagnostic testing under our services tab. You can research a bunch of information that's listed there. And remember, our goal isn't just to try more things. It actually is to help you to finally experience the optimal health that you long for. Thanks everybody for listening in today.